It's a very important message that a sore throat in a child must not be neglected, must not be ignored, because if it is caused by strep, it could indeed lead to heart disease, which is why we encourage mothers and caregivers that when their child, particularly between the ages of 5 and 15 years, which is the period in which you get rheumatic fever the most, we encourage them to take the child to the clinic, to the doctor, so they can be examined.
Okay, rheumatic heart disease is a problem of your heart valves, but it follows another disease that's called rheumatic fever. So rheumatic fever occurs mainly in kids. It occurs after you get an infection of the throat, usually with a bug called the streptococcus bug. Classic sore throat that school kids will get. In some of those kids, when that infection gets better, 2 or 3 weeks later they'll get sick.
They come into hospital with shortness of breath and swelling of the body.
Brooklyn came into hospital 2 or 3 months ago now, and she came to hospital because she had the sore joints, the swollen joints. And this is a condition they're called rheumatic fever. Do you know anything about rheumatic fever?
Not really.
It starts from a simple skin or throat infection, which is very, very common in low-income countries. But once you have rheumatic heart disease, without any intervention, this is something that you will usually have for the rest of your life.
So you have rheumatic heart disease, is that right?
Yeah.
Yep. And have you had operations before?
Yes.
How many have you had?
3.
3. Okay.
You know, it's affecting kids, it's affecting adolescents, young adults, and it's causing them to have the heart failure. What does that mean? That means that they can't breathe properly. It means that when they exercise, they run short of breath. It means they get swelling of their arms and legs. And unfortunately, it means that they sometimes die. So really severe heart failure causes the heart to just give up.
There are probably 15 million or even more people alive today who have rheumatic heart disease. Many of them are desperately ill, and the only thing that will help them at this point would be a heart valve surgery, a new heart valve, a repaired heart valve. Most of them will never be able to get it. 250,000 or more people per year die from it. We're talking about a disease that we know the cause, we know the cure, and yet you still have 500,000 new cases a year. There's lack of education on it in the areas that it affects the worst, and that's why you get so many deaths that occur in the younger population, teenagers, young adults. That makes it very tragic.
Rheumatic heart disease appears to affect the poor, socioeconomically disadvantaged families, an enormous problem in the Indigenous population of Australia and certain low and middle income countries.
In the developing countries, who happen to be 80% of the world's population, this problem continues at a high rate. In places like China, in places like India, in certain communities in Australasia, in Africa and South America, we still have this problem.
Is there a problem with weather or climate or something?
Rheumatic heart disease used to be very common in Melbourne and Sydney and Brisbane, even in the big cities. But now it's a disease of the top end of Australia mainly, and there's a number of important factors. One of them is the housing in the top end is not as good as it is in the southern states. There's a lot of people who share one house, a lot of overcrowding, and it's not Brooklyn's fault.
One of the strongest medicines for rheumatic fever and rheumatic heart disease is in fact social development.
The problem, I think, is living conditions. It's really about the environment that children are growing up. If they're in a situation where there's overcrowding in terms of housing, where there's that opportunity to spread a throat infection from one to the other.
If you get rheumatic fever, what we can do is we can prevent you getting it again. So we have a way of intervening using the most simple antibiotic we have.
Yeah. Did you for your rhinitis be tested?
Penicillin injection for sore throat is so successful against stopping rheumatic fever.
We're trying to prevent people having to either get life-saving cardiac surgery, or if they don't get access to that, we're trying to prevent them dying. We're talking about the cheapest antibiotic in the world, penicillin. We're talking about a process of making sure that the normal healthcare system is equipped to care for these kids and to prevent this disease. So it's not complex and it's not expensive. We just need to get people interested and aware.